Today we had a client who was scheduled for a composite filling on her upper left second molar. The appointment was at 4 p.m. and she arrived at the clinic after a busy day at work. The dental assistant man greeted her warmly and took her to the operatory. Before the procedure, she updated the client's health history and gave her mouthwash to pre-rinse for 30 seconds. After that, the CDA placed the bib on the client and ensured that she was comfortably seated in the dental chair waiting for the dentist. During the procedure, the CDA kept checking if the client was okay to ensure the treatment was progressing smoothly. At one point, the client felt a little bit dizzy, but she informed the dental assistant that the procedure could continue.
When the CDA tried to make sure the client was still doing okay, there was no response from the client. Her face turned pale and she lost consciousness momentarily. In this situation, the procedure must be stopped, and the CDA placed the client in a subsupine position right away. She then asked another dental team member for help to bring up the medical emergency card. Here's what a CDA can do when faced with a patient experiencing an emergency, and the equipment we can find in the medical emergency kit. We can use a blood pressure cuff and pulse oximetry to monitor the client's vital signs immediately. Administer oxygen using the oxygen mask with the tank. Also, we can use ammonia inhalants as needed. The inhalant should be held away from face and crushed between the fingers, then held about 4 inches away from the nostrils, and the vapor should slowly be inhaled until the client awakens or no longer feels faint. Last but not least, the CDA can also offer apple juice to client to help alleviate low blood sugar levels.
The client regained consciousness after a short period under the implementation of first aid measured by the CDA. Once the client felt stable, the CDA engaged in a conversation with her and learned that the client hadn't consumed any meals today, some snacks and coffee. Little did the client know that hunger and dehydration were silently taking a toll on her, leading to a potential syncope episode. Moreover, when the dentist administered anesthesia to the patient, she felt fear, but because anesthesia is a necessary step in the procedure, she was too scared to inform the dental team. In the end, the CDA gave the patient apple juice and arranged for the next appointment.
Syncope is the most common emergency in dental practice. In our scenario, fear of anesthesia needles, procedure anxiety, hunger, dehydration, and fatigue may be the factors that lead to this accident. While the syncope episode was unexpected and challenging for both the clients and the dental team, the CDA's quick response and syncope preparedness training play an important role in ensuring the client's safety. The experiences brings up some tips that we can use to educate our clients before dental treatment as a CDA. Number 1. Provide a written or verbal instruction while in evidence of the appointment, including information on hydration, nutrition, and any specific fasting requirements. Emphasize that proper nutrition and hydration are essential for overall well-being and can positively impact their dental experiences. Explain how these factors can affect their well-being during the dental procedures. Number 2, advise clients to drink an adequate amount of water in the hours leading up to the appointment. Suggest avoiding excessive caffeine or sugary drinks, as they can contribute to dehydration. Number 3, recommend easily digestible foods, such as soups, yogurt, or smoothies, to provide sustained energy without causing discomfort. Recommend having a meal or snacks 1 to 2 hours before the appointment. Number 4, explain to clients that hunger and dehydration can contribute to feelings of dizziness or fainting. Encourage them to inform the dental team promptly if they experience any discomfort before, during, or after the procedure. Reinforce the importance of communicating any concerns or discomfort of the dental team. Let clients know that breaks can be taken during the procedure if needed. Number 5, for those clients prone to syncope with limited time for meals, we will encourage them to schedule their appointment approximately 1 to 2 hours after finish their work to make sure that they have enough time to eat and drink before their appointments. Number 6, for clients who are easy to feel anxious about surgery or anesthesia, we need to instruct them to relax through deep breathing exercise. We can guide them to take a deep breath for a few seconds, then exhale slowly, repeating this process several times. This can help reduce anxiety levels and increase comfort.